Well, I'd like to open up, and thank you very much for that introduction. I'd like to open up with a story. And you mentioned Villanova Law School, and this happened right up the road. And I'm a second-year law student. And I was interested in trial law. I was a trial lawyer for a while, and they had this course on Saturday morning. It was trial practice. And you went there like 8, 9 o'clock in the morning, and you had a 2-hour session with this really animated professor. And there's about 20 of us. And he's up there at the podium, and the janitor walks in to the room and starts cleaning the room. So the professor says, can you go and do that and come back here in about a half hour? And the janitor says, no, I'm supposed to be in this room at this time. And the law professor says, well, why don't you go to the next room and do that, and then come back here, and then you'll have, your 2 rooms synced up. Well, things keep on going on like this. And I mean, it's getting heated. And the next thing you know, the janitor takes out a gun and shoots the law professor. The law professor's behind that podium and goes down like a rock. We're sitting there observing this. The law professor stands up and asks us 10 questions. What time did this start? Who spoke what words first? So on and so forth. Now, we're 20, 25, reasonably intelligent people. What the hell we got into law school, right? And none of us had the same answer to any one question. And if I were to ask you right now, what were the first words I said, or what time did I first start speaking, there'd be a variety of different answers. And how long did this story take for me to tell you? Now, that's a story about perception. Why am I telling you this story? Well, this law is going to raise a lot of different perceptions. The legislative history in itself is unique. Most laws you have initiated by either the Senate or the Congress. The Senate has a version in response to the Congress. The Congress has a version in response to the Senate. There's a reconciliation process, and then it goes to the president for signature. In this situation, none of that was done. You had one act passed in March 23rd. That was the first step. And for those things that people didn't agree to by March 23rd, they had another week to clean it up, and they signed another statute they gave the president to sign on March 30th. You didn't have the reconciliation. You didn't have the technical corrections. You didn't have any of the jazz you usually have when you have legislation. And yet, the law requires certain things to happen by June. And to give you an example of how these two statutes mesh or don't mesh, you've heard, now you have to cover dependent children until age 26. Well, the first law says you cover dependent children, adult children who are not married, and it says until the child turns 26 years of age. The second law says any child of a taxpayer of a taxpayer now, a whole different standard, must be covered until the taxable year in which the child has attained age 27. Okay, you got a kid who's 26 in January. Under the first law, when he turns 26, that child no longer has to be covered. Under the second law, he's not 27 until January of the following year. That's the taxable year that applies to that kid. That kid's on the payroll for a lot longer. So that's only a smidgen of what we're dealing here, what we're going to be dealing here in this statute. Larry Seisler and I were talking this morning about how Larry's big deal with Blue Cross. And we're talking this morning, like you, my dear. And we're talking about this regulation that came out, what, 2 days ago or yesterday, about this subsidy that is being offered for early retirees between, from 55 to retirement age. And they can get a subsidy for medical costs. And the total amount of this subsidy is $5 billion. And if you apply for this subsidy, you're a plan and you want to apply for it, you've got to move pretty quickly. And if you get 80% of up to $90,000, which is the maximum subsidy allowance, that's $72,000. And I don't think that's realistic, but it goes from like, what, 30 to 70 to 90 or something like that? 15. So let's say it's 70%, 80% of $50,000. That's $40,000. How many people do you think that affects? And how fast do you think that $5 billion will go? Larry did the math, and it was like very few people affected if you take those parameters. This $5 billion is like an hors d'oeuvre. So some of these things were thought out, some were not. Everybody's going to be scrambling to apply for this subsidy. There is no application form yet in the system. Those people who want to scramble are on their websites right now waiting to see if an application form comes out. This is what we're going to be dealing with here. Because catching up with this legislation that was so hurriedly passed, and we all understand why it had to get passed, in the way it did. I'm not going to get into the politics of the situation. Now everybody who is creating the regulations that follow these statutes are going at 100-mile-an-hour speed to try and keep up with the demands of this statute and its timelines. You've all heard this is sweeping legislation, and we're trying to figure out, and we're scratching our heads as to what happened and how do we deal with it. Although the biggest changes may not take effect until 2014, we got a lot of warm-ups along the way. And there's going to be important provisions kicking in June, like this subsidy that I just mentioned. There's going to be new restrictions on the insurance industry. There's going to be a new regulatory scheme for the insurance industry. You've got to look at the insurance industry. It registers with insurance commissioners in each state. It hasn't had to go through a major regulatory process with the federal government. It is in for a wake-up call. And I'm convinced that the federal government is going to regulate this insurance industry who really lobbied to get this bill. I mean, after all, with all due respect, you got 32 million more participants. And that's a big plus for the insurance industry because that means premiums and insurance and coverage and things like that. And a lot of them are younger and in either good to excellent health. So that impact will not be as hard as some of the other impacts on the insurance industry. But once the insurance industry is under a federal regulatory model, that's going to have a tremendous impact on the industry. We don't know what yet. I was speaking yesterday or 2 days ago with a woman who was on the health care reform panel that helped, advise the president on some of these measures. And one of the things I was saying to her, well, how's this thing going to save costs? We know how it's going to raise money. It's going to there's going to be additional FICA taxes on people who are high earners. There's going to be higher taxes on unearned income of high earners. I don't know that the excise tax on Cadillac plans will really realize much money because people are going to do everything they can to avoid being a Cadillac plan. But there are ways to raise money, but I don't see anything here about lowering costs. What she told me was that there are incentives here, and that we're going to see Medicare, for instance, is going to change certain allowances. procedures. It's going to reduce, for certain procedures, the cost allowed for those procedures. That's a benchmark for the insurance companies. That's a big one. And hospitals and plans. They're going to reevaluate what they're going to allow because Medicare is usually followed. You know, hernia operation. This is what's allowed, and we're reducing the cost of that. Therefore, hospital, you now have to do it at a lower cost. What's that hospital going to do in response? The hospital is going to try and make sure that it does it right because it's going to bear the risk of that patient coming back because of a problem and having more treatment that won't be paid for. They'll try to recategorize it. Used to that. But there's going to be more regulations and impositions to restrict what hospitals have been trying to do to get around some of these things. What's the overall result? Better care and at lower cost. There's an experiment going on now in Maryland with physicians. Give a doctor a caseload of 1,000 patients. That's it. It kind of derives from the model of an executive or boutique doctor that we have, you know, in a lot of cities, where you pay a doctor a fee, you get an appointment when you want to have an appointment. He is a skilled professional, and you may not get reimbursed from insurance, but you got great medical care. Well, this is instead the insurance company hiring a doctor saying you've got 1,000 patients to cover, and if you cover them well, you won't have to work as hard because they're not going to come back to you because you didn't do the right thing. But you bear the risk of their medical care, and we're going to pay you a good number to take care of them. Another thing I think we're going to see coming out of this is more defined centers of excellence that are focused on certain procedures. You know, we have our burn center, St. Chris. We all know that. But I think you're going to see different kinds of centers develop. This dialogue has been going on for years. I remember seeing a program on NET 30 years ago about their attempt to do this in Denver. But now there may be motivations because of this legislation to get more centers of excellence. The heart place is here, you know, for cardiology, you know, and anything related to heart. The orthopedic place is here. If it's not Rothman, I'd be surprised. But I mean, you know, that kind of thing that may start developing because of their ability to do those procedures they do day in and day out more efficiently, more correctly, and provide more cost-efficient coverage. I don't know how this is going to affect the teaching institutions. You still got to have your HUPs, your Temples, your Drexels, and they have to teach medical students, you know, all the areas at some point. And I don't know how that's going to play out. I also think that medical care is going to be delivered very differently. I think that there's going to be secure websites over which a patient presents its problems and symptoms. I think there's going to be more reliance upon nurse practitioners to handle routine problems. We may be able to talk to our docs on a cell phone and get treatment, prescriptions, etc., you know, handled that way. So these impacts are all pretty significant, and I have come right within my time limit, so that I look forward to your questions and talking to you further.